When it comes to treating rheumatoid arthritis, I have a bit of a hot take for a rheumatologist, and that is, I don't have all the answers. It's true that we have made amazing advancements, and I have more precise medications than we ever have before. But it's also true that how to use them and who they are best suited for and how they fit into the bigger picture of your life is more art than science. So today, let's discuss how to create a personalized rheumatoid arthritis treatment strategy for you. Step by step, I'll lay out the key facts you need to know about your RA, give you a peek behind the curtain as to why your doctor makes the recommendations they make, and then how to put this all together into a plan that'll work for you. I'm Dr. Elizabeth Ortiz, and this is Connected Rheumatology. Let's get started. No one teaches us how to be a patient, not really. When dealing with a chronic condition like RA, we have to learn on the fly how to manage the multiple conversations and decisions that need to be made. What sits right with you and fits within your worldview is a big way we can personalize a care plan that's going to work for you. In order to best do that, however, you need to understand your flavor of rheumatoid arthritis. Everyone's RA is different. Some are mild, some are more severe, and some are very responsive to lifestyle changes, and some aren't. When we are coming up with a personal plan for you, we are constantly weighing the risks and benefits and pros and cons, and in order to do that with as much precision as possible, we need to understand the severity and the risk of severity for your RA. So what does that mean? Well, we do know that there are certain factors that put someone's rheumatoid arthritis in a high risk for joint damage category. There are 3 factors that are baked into your RA and one that you totally have control over. The first is whether or not you have the typical autoantibodies for rheumatoid arthritis, the rheumatoid factor and the anti-CCP antibody. If you have these antibodies in your blood, then your rheumatoid arthritis is called seropositive, and if you don't, we call it seronegative. Seronegative rheumatoid arthritis tends to be less severe. This means the risk for long-term joint damage or other organ damage from inflammation is less than if someone has positive autoantibodies. The second risk factor is the presence of joint damage on your x-rays, even if it's small. Once we see small joint changes, otherwise known as erosions, we know this flavor of RA is capable of doing more damage. Damage usually leads to more damage, so we want to prevent as much as possible. And the third risk factor is how much inflammation you have in your body. We get a good idea of this by the number of swollen and tender joints you have, the level of your CRP or sedimentation rate blood test, or if you have any other symptoms of RA outside of your joints, like nodules or lung issues. Not everyone's RA comes with the same level of inflammation, and we generally see that those with high levels are at higher risk for developing those irreversible joint changes. And then, the risk that you have control over is smoking. Smoking with rheumatoid arthritis can put you on the fast track for higher levels of inflammation and joint damage. But thankfully, this is something that we can do something about, right? So if you don't know already, ask your doctor and take note of these things. Do you have the positive rheumatoid factor or anti-CCP antibody in your blood test? Did your x-rays show any evidence of joint damage from rheumatoid arthritis? Do your inflammation blood tests, the CRP and the ESR, show that you have very high levels of inflammation? And then if you smoke, if they have any resources or referrals for you to start the process of quitting. When putting together a personalized rheumatoid arthritis care plan, you obviously are going to be working with your doctor. So it's important to understand that your rheumatologist's goal is to stop any and all inflammation from your RA in order to protect your joints. That is their number 1, 2, and 3 priority. The reason this is their top priority is that we have many studies that show if you control inflammation tightly, you can prevent joint damage, disability, and even protect the heart from the effects of inflammation. Studies showed us that for many with RA, there is a window of opportunity where aggressive control of inflammation can make a long-standing impact on a person's joint and overall health for years down the road. And missing that window of opportunity may put someone at risk for the long-term consequences of RA inflammation in the joints, but also elsewhere in the body. By the strictest definition, we are trained to snuff out any sign of inflammation, whether it's one swollen joint or one slightly elevated blood marker. And we snuff it out with the main tool in our toolbox, which is medications. When following this strict treat to target strategy, which is what we call it, by the way, with remission being the target, when we follow this strict strategy, rheumatoid arthritis treatment does become a bit algorithmic. But I and many of my colleagues have found that sticking to this too strictly completely ignores the person this actually affects, you. Your life and health doesn't follow some protocol, and so your treatment shouldn't either, and this is where the art comes in. When we are facing an autoimmune condition like RA, we absolutely should have a say in how we care for it. If you have other interventions you'd like to look into or try, they should be and can be incorporated into your care plan along with your doctor's recommendations. I like to think of everything as interventions. This includes medications, but also diets, exercise routines, mindful practices, supplements, or any other thing you might try to control your RA. Each intervention will have certain data and theories as to why it may help and to what extent it may help. Medications have more data than most other interventions, which is why they are the go-to recommendation from your doctor, but that doesn't mean they are the only intervention that can have a positive impact. This is where knowing the specifics about your RA can make a difference, because you will want to weigh the likelihood an intervention has a positive impact with your risk for severe joint damage from inflammation. Say you have multiple risk factors for joint damage. You have positive anti-CCP antibody, you have high inflammation markers, and you want to try an anti-inflammatory supplement to control your rheumatoid arthritis. Based on the available data, the chances that a supplement will, on its own, control your RA is low, especially if you have high inflammatory markers, and I'm generalizing to make a point. Now you may say, well, I'd still like to try, and that's totally fine, but I recommend giving yourself a deadline. Because the risk of trying something for a long time that isn't working, especially if you have a risk factor like the anti-CCP antibody, well, the risk is that you develop joint damage, and that joint damage is irreversible. If you don't have high risk factors, then the risk-benefit calculation may be different. We always try to make the best decision possible with the information we have at the time, and your flavor of rheumatoid arthritis and your risk for joint damage has to be taken into account when deciding on any other treatment intervention. It can be tough to weigh these factors with precision, simply because we don't know. Whatever intervention you want to try, there is inevitably an element of trial and error to this. Nothing works for 100% of people 100% of the time. Whatever you decide, these are the types of conversations we need to be having in our doctor's offices. What interventions you want to try, how long you should try them for, and why they appeal to you in the first place should get dedicated time in our visits. Treating rheumatoid arthritis in our clinics is often approached in a very cold, black and white kind of way. But to me, treating RA is really about learning how to take care of yourself with RA. And taking care of yourself is an art, not a science. So of course it needs to be personalized. I hope you found this helpful. If you want to dig in more, check out the Connected Clubhouse, a private community where we get your questions answered by experts like me and others on a similar journey. That link will be in the description box. If you want to learn more about the #1 medication we prescribe for RA, methotrexate, I recommend watching this video next. Have a great day, and I'll see you next time.